Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done, you're okay. Your baby's nearly here. Oh, here we go.
A baby being born, to say that you're part of that, something so life-changing for a couple is just amazing. And that's why I'm here. You just like to think that you've done your bit in relation to the fantastic day that they'll be celebrating for the rest of their life. It's brilliant.
On the delivery suite, midwives Ellie and Daryl are looking after Dublin teenagers Kaye and Owen, who are expecting their first baby.
Since I got pregnant, I don't think I've bought myself much stuff for leggings and that. Because anytime I go in, I'm like, come on, we go down to the baby stuff.
Oh, the stuff is gorgeous.
Yeah, it's so hard.
That's why I hate going into Penny. She's like, I just need to go in and get knickers and socks. I say, yeah, right.
It's never knickers and
Best
socks.
is baby girls.
How long are you together?
Just over a year.
I only need to get her 4 months when I got pregnant. Sure, no, doesn't matter.
No holiday, baby.
Yeah, he was made in Bulgaria.
I've 5 sisters and a brother. And there's 3 younger than me. And my nephew, and there's just always been babies in my family. So I knew I would be all right. We all work in here and crying.
I know.
I just love having kids around.
Slowly blow it out.
The contractions were, I don't actually think that it's a pain I'd ever forget. It was just like all around my waist down to like nearly above my knees was just tightening. Every contraction gets worse. Yeah. It's awful.
Great.
I was in labour for 3 hours without an epidural because I was trying to like let it go as long as I could, but then it got to the point and even the midwife said to me, she said, yeah, I don't even blame you. Like I was like, no, I needed it, like.
Oh, this is not nice.
I'll do it the next time, okay?
Just the next time. Never again.
No.
We'll see. No, actually.
Kaylee has chosen to get an epidural to help with the contractions. It's tough going for Owen.
Needles. Like every time you should get the epidural or whatever, I'd have to turn my head up. I just don't do needles.
Okay, put the head
It's
up.
okay, you can move now
A
again.
little bit of coffee there, are you?
No, it's falling asleep.
Well done.
If I was to get one, it would be kind of somewhere a little bit. My friend has a Chinese symbol just there, and it just means friend. Well, that's what your mom told her. It says it means it could mean like fanny. I don't know what it means. Nature.
Alan and Lorraine are expecting their second child today. They already have a boy at home and are hoping the omens are good for a girl.
Yeah, just the balloon that from the last baby went up. There's a pink balloon, so it might be a sign of a girl.
I didn't really have a first impression of Alan, if I'm totally honest. It took a few dates, basically. He won me over in the end. So, yeah.
She didn't fancy me at the start. She hates when I say that.
So, I mean, of course I fancy him now. Like, I married him.
While Lorraine and Alan are expecting their second child today, Lorraine is well used to hospitals. She has been in and out of them since she was a little girl.
My kidneys had never grown from birth. They didn't find this out till I was 9. So when I went to my GP, I was very sick. And he didn't know, basically, how I was still alive. We know by the time I got into Chapel Street, I was in ICU that night for 3 weeks. So, yeah, it just kind of went from there, like, you know. I started doing dialysis in Chapel Street, and my mum and dad then took the dialysis machine home. And they did it every night at home.
the age of 10, Lorraine received a donor kidney and underwent a successful transplant.
As a child, I wrote a letter then to the donor's family to say that I was so thankful and to give me the second chance of life. The lifespan, I think they say, of a transplant is 10 years. I have mine 24 years. So for that, let's hope that it still continues to go for another 24. You know, maybe double that until such time that, you know, I'm here and I have to leave, you know, that my kidney comes with me.
Pregnancy and childbirth can be high risk for those who have undergone organ transplantation, but Lorraine and Alan were determined to have another baby.
So we'll be getting you in shortly now, and we'll be extra cautious about bleeding just because the blood count is at slightly lower level, your hemoglobin.
Okay.
While you might offer recommendations to a patient, I feel that it's not up to me to tell a woman how many babies she can or should have. At the end of the day, that's the couple's choice, no matter how high risk they are. You know, some women you can counsel and they might have up to 30, 40, 50% risk of mortality in pregnancy, but yet it's their choice. I'll just support them and do what I can and hopefully have a good outcome.
Lorraine is about to go to theatre to have her second child. When she first met Alan, she was worried that she couldn't have kids at all.
Obviously, I wanted it just as much, but when you love somebody so much that you just hope that you could be that person to give them what they want to. He was always so supportive, you know, and always so reassuring.
Where are you going with, boy or girl? All this blue might be a boy. I think we were with each other about 4 or 5 years at the time. And she said, look, if it's going to be an issue about kids down the line, where do you stand? It's like, it's not going to make much difference. Like, I'm not going to go anywhere. I said, look, we'll play it by ear. It's amazing, isn't it? Take a baby out, you like.
Usually, if you're doing a caesarean section, you're nowhere near the kidneys. However, in transplanted kidneys, and in Lorraine's case, it is transplanted onto the right side of her abdomen. So it could actually be whenever you could palpate it during pregnancy, you could feel it. You could feel the kidney under her skin. And so therefore, it was quite near the area that we would usually go through if you're doing a regular caesarean section. So in order to avoid damaging the kidney or going anywhere near the kidney, you make an up and down incision.
Just kind of there to there, really.
Yeah. I would never have been able to have a natural delivery. The weight of the baby and the pushing at the end would have put too much pressure on the kidney.
Yeah. Seems to be okay. Is they happy with it?
Yeah, I think so. We should be okay.
Let's go. Yeah.
Oh. There we go. Hello, baby. Oh.
The doctor beside us, he was
Brilliant,
cool, wasn't he? Yeah, he just, so what's the guesses, he said, and I was just joking. I says, well, I ordered a girl, so it should be a girl, you know, and Lorraine was like, stop.
That's right. Hello. Hello. Baby. Leg cord tapping.
I won't look until you can see.
In that moment, you can't believe you've made this little person.
You were so shocked that you didn't even know if it was a boy or a girl, didn't you?
Yeah, I was kind of looking at him.
So they had to take her away straight away, so Lorraine turned to me, she goes, is it a boy or a girl? I said, it's a girl. Yes. I told you it was a girl. Just like the first time with James, yeah, you just feel so blessed, yeah. See, she's perfect.
Is that okay? It's perfect.
Yeah, we just have to figure out what we're going to call you.
never know, there could be a fourth generation working here.
Not yet.
No, not yet.
Not for a long time.
When I started in '84, there was all foreign students. They'd come in September and they'd live in until March. They had this small room, they had to eat and sleep and look after themselves, which they weren't used to. There was one of the girls, she was 26, and it was her first time to wash her own hair. And she asked me, could I help, you know? It was
So you're hairdresser as well.
Where are you from?
I'm from Clare.
We seen a thing on Facebook last night and I was like, does anyone actually know anyone from County Clare? Because I'm starting to think it's not a real place.
Well, you met the best one. Am I okay to go ahead? Yep, that's all right.
Ellie is checking how far dilated Kaylee is after 4 hours on the delivery suite.
At the minute, it's just about 2 fingers, so just about the top of your 2 fingers, so about 1 to 2 centimetres, but it's paper thin.
Still a long way to go.
No. It might get quicker, hopefully.
You never know.
Two hours later, Kaylee is hoping that her labour has progressed.
It's probably kind of more or less the same as what it had been.
Oh.
But the baby's head has come down a good bit.
To let time pass, it was just dragging in. Felt like I was there my whole life.
I'm gonna be here all night, aren't I?
It's just frustrating because you've already had well over 24 hours of being here and after your water's breaking and everything.
To try to move her labour on towards her preferred natural delivery, Kaylee has been put on an Oxytocin drip.
Is that okay? With that drip, there's only so much of it you can have. Like, we can't keep flooding your body with it if it's not doing what we want it to do. But at the minute, there's nothing set in stone that it's going to be a section or anything like that. But just
It's like there's a course in my family of having to be sectioned because my mum had 2 and me and my sister. My sister had twins and she hadn't, and they're all emergency sections. So it was like I was waiting, like I just had a feeling the whole time, like I'm gonna have to be sectioned. Like I wanted to break that course in my family.
Yeah, I'm just scared.
It's perfectly fine, babe. Because you're doing great. You're doing great, babe.
when we were looking at the tracing of the baby's heart, there was little kind of decelerations, which is like a little dip in the baby's heart, is what we call them. But the progression that we'd expect wasn't there. So I think as I was leaving, there was talk that maybe in another 2 hours, if things hadn't changed, that she would possibly be for a cesarean section at that time.
Hello in the house.
Look, it is.
Hi, Sean. Hello, how are you doing?
How are you?
Good evening.
Are you coming in here now?
Huh?
Are you
I
coming
am
in
indeed,
here?
yeah.
I was told that I'd be blessed if I get my midwife, so.
Oh, look at you there.
You do the short straw. So you're saying there now you say it?
No.
No, you'll be delighted with.
I went about the business with Ellie of finding out exactly what has been going on in this labour so that I'm up to speed and know where we are.
Like, she's kind of looking at a section at that point, I suppose, because she is contracting. Then she discussed...
That's what he said.
Told to take him out the sunroof.
I'm sorry.
With Lorraine still in theatre, Alan is taking in his baby daughter, only minutes old.
Just surprised because I kept saying it's going to be a girl, it's going to be a girl, you know, and then it's a girl, so surprised I was right. Well, I was warned by Lorraine's mum, Mary, ring me first. So as soon as Lorraine went into recovery, I rang Mary and she answered the phone straight away. And I says, well, what's the guesses? And she just said, no, just tell me. Baby girl. I rang my mum and she hadn't a clue. She didn't know anything was going on. I think we told her we were just in for bloods or something like that, and we weren't going back in till the following week. Yeah.
You know I won't be here this Sunday.
I know. I'm holding my little daughter here.
What?
I'm holding my little daughter here. I'm holding my little daughter.
You're messing
I swear to God.
Alan, you're messing.
I'm not messing.
There's not a day that goes by that I don't think of my donor. There's not one day. And their family, especially their family. If it wasn't for my donor, I wouldn't be sitting here today and have 2 beautiful kids and a husband.
We don't want to take any more risks. And we had James, and we're being very lucky to have Lara, and I think
that's it.
We're happy now just to have the 2.
Very happy.
Ah, she's perfect. As you would say, Matt, if you bake the cake, that's the way you'd want it to come out.
If you bake the cake, that's the way you want it to come out.
Yeah. Cheers, bye-bye. She's going to kill me.
In room 9, midwife Sean is getting to know Kaye and Owen.
Who are Liverpool playing tomorrow?
We're playing West Ham Monday night.
Monday night, okay. Just hope he doesn't grow up now. He'll be a Leeds fan or...
Yeah, right. Born a red, live a red, die a red.
Tottenham Hotspur. Don't tell him.
We were just sitting there and talking about anything, and like it occupies you a lot, like your mind, just talking. And
it got to a stage where he was laying on the bed, sitting down, just holding that hand, talking to her, just reassuring her.
How old was he? Did he have
70.
70? Okay.
But he had said when he got cancer that he wanted to be home for his 70th and he wanted to be still here for Christmas.
Yeah.
And he was, so...
But he was surrounded by family.
Yeah.
Do you know, you can't ask for anything better than that.
No.
Really, you can't.
Like, we were all there when he took his last breath. It was...
Okay. That's a lovely thing.
Yeah. And he was like, we'll make a deal. Said what he said, I'll try my best to get home from here.
Yeah.
So I can see the baby. But he was too sick, like, to hold on for it like that.
Yeah. Anyway, you can look from the other side.
Yeah.
I'll be back in one moment.
Yeah.
He's loaded, isn't he?
Yeah.
It's now 12 hours since Kaye and Owen first entered the delivery suite, and finally it seems like things are progressing well.
they checked and I was 6 centimetres, and then it was just a little while later and I was 10 centimetres because it happened so slow, but then went so quick.
That's the one. Yeah, that's the push. Keep going, keep going, keep going, keep going with that push. You have this baby on the move.
I don't think I can do this.
I think you can. Honestly, I think you can.
I know you can.
How are we doing? You all right, Kayla?
I'm not moving.
Hold it and chin forward, like I said, and that's it. Right into your bottom. Come on, keep going, keep going, keep going.
That's it, that's it, that's it, that's it, that's it, that's
Come
it.
on.
Could you just come out?
Okay, yeah, he will come out, he will.
He was like, no, come on, you're nearly there. But I knew myself that I wasn't. Like, I could feel it, but I knew that he wasn't coming out, like.
I'm going to ask Catherine, one of the doctors, to come in and see. It's just that baby is getting tired after a contraction. From a safety point of view, we can't let this continue for a long period of time.
Oh, it's just to help him get out.
Someone told to happen to him.
Baby, I can't do it.
I know.
Don't get upset, Kaylee. Come on.
My back is so sore.
Listen, you are almost to the end.
Apparently the Rotunda is haunted. There's a myth going around about Sister Sarah. One night, the bell went off. There was no one in the room, and I was like, right, Joe, just, be brave here now and just go around. And I went around all of the bedsides just to check on the women, to make sure they were okay, and to check on the babies. And I do remember at that time, there was one baby that was blue. Mum was asleep, and the baby wasn't crying, it was just choking, it was going blue. And I feel like that was Sister Sarah, telling me to just keep an eye, and it saved the baby. So maybe Sister Sarah is true.
Fire a little more.
Baby, I can't do it.
You can, I believe. I believe you can.
In room 9, Kaye has been pushing for nearly an hour, and she's finding it hard to cope.
If things aren't going well, that's why the medics are there. They come in and we work together to get a delivery. In this particular case, it happened to be a Kiwi vacuum delivery. Okay, come on, here we go. I can feel it now in my fingers. Big deep breath. Hold it and big push into your bottom. That's it. Keep going, keep going, keep going. Here we go.
That once they start suctioning the baby, I only had to push about 3 or 4 times or something, and then he was born.
That was good push, Katie.
Oh, she was just short of putting her foot on the edge of the bed and pulling him out.
Here he comes. Push, that's it. Well done, well done.
A little push, a little push, a little push, a little push, a little push.
Well, there you go.
Look down, Kayla. That's it, you. Well done.
Well done, baby.
Congratulations.
Hello, Harley.
Why is he not crying? Why is he not crying?
That's all normal, that's all normal. He's not ready to cry.
We only had 2 seconds out.
Now we bring him over to the baby doctor, okay?
Please say so. He's had to open his eye.
He's fine. Hello, baby.
Please cry. Please cry.
He's fine.
Once we heard him crying, it was just like the whole weight just lifted off my shoulders.
Because of the way things went, because his heart rate kept dropping when I was actually in labour, he just started screaming, and it was great because it was great to actually hear his little cry. That's all I wanted to hear.
From a distance, I can do that from here. Let's get you over to your mammy. That's the main thing. Over there to your mammy, because that's where you need to be, Mr. Man.
So early, babe.
Now. You need to be against your skin on skin.
He was so different to what I thought he was going to be. Like, he had dark hair when he came out, and it was just mad, but I just loved him when I saw him. It was the best moment of my life. It's kind of in my head, like, someone depends on me now. So that's what, like, kind of makes you grow up. But
Hey, little man. We're not kids anymore, like, you have a responsibility. We're parents. It's daddy.
I love knowing that, like, someone is going to depend on me. Like, I hope he loves me as much as I love my mum. Like, I hope it is like that when I'm older, and that he can talk to me like the way I talk with my mum and all that. Yeah.
We'll give your poor mummy's heart broken over there. You're already a little gurrier, aren't you? What's this place? This isn't where you used to live, is it?
If he turns around and tells you he's poached anyone else other than Liverpool out of the house.
And it was meant to be that we were put in this room as well, look. D9, Dublin 9. You're a true Ballymunna, son. You're a true Ballymunna. It's okay.
This patient, I was giving out the bottles on postnatal, and she came up to me and she's like, you wouldn't give us another bottle there, would you? And I was like, oh yeah, I'll be around now with the bottles. And she was like, no, she says, me fella can't read, and he thought that the Aptamel was an Actimel, and he's after drinking it there. I was like, all right, yeah, I'll get you the bottle. I was just like, oh, it's an easy mistake.
This baby's moving around very well. There's lots of...
In fetal assessment, parents of 2, Samantha and Anto, are in for a 20-week scan. They're expecting identical twin boys.
On the first scan, I thought she was after flipping the screen because the baby's head was from the left and the body to the right. But then that part of the screen went off, and then we seen the baby's head on the right and the body to the left, and I'm like, am I seeing things here? But then she's like, I think you have 2 in here. And all me and him kept doing was laughing, didn't we?
Yeah, it was great.
But we were delighted.
Samantha has been transferred from the Coombe Hospital in Dublin for treatment in the Rotunda because her babies suffer from a rare and dangerous condition called twin-to-twin transfusion syndrome.
You can see the umbilical cord again here. This larger baby's getting too much blood supply, and he's going to get into trouble with heart failure if we let this go on.
Okay.
And this smaller baby over here is not thriving.
In about 20% of cases of identical twins, one baby gets too much blood and the other baby gets too little. This results in one baby getting into trouble because of heart failure and eventually dying, while the other baby gets into trouble by not thriving, by failing to grow because the baby's not getting enough blood. The treatment for this is to put a camera in through your abdomen, around over here. It's going to come into the amniotic fluid sac here, and we're going to look at the placenta here, and we're going to find all of the blood vessels that connect the two umbilical cords together, and we're going to seal off those blood vessels so that there's no way for blood to get from the smaller fella over to the larger fella. Unfortunately, in a small number of cases, putting a camera into the abdomen in here may cause the waters, the membranes, to rupture. And unfortunately, if the membranes rupture at 19 weeks, most people end up losing the pregnancy, a miscarriage.
We did say to the doctors, just be blunt with us and tell us out straight, because we want to know what to expect, even though you don't really want to hear it.
If we do nothing about this, in up to 90% of cases, the babies will die.
Okay.
So I think doing nothing isn't really an option for us. And we'll get the surgery done this afternoon.
Okay, thank you.
Okay?
Okay, thanks.
Any other questions? It was clear that her twin-to-twin transfusion syndrome was already well established and was very serious, in fact life-threatening. For that reason, we brought Samantha directly to the operating room to perform the surgery. Now let's do our laser fibre, yep. Fetal surgery in the womb for twin-to-twin transfusion syndrome is a highly specialised procedure that's only done in a small number of hospitals around the world. Now we have up here, now again, a tiny fetoscope, a camera, is placed through the mother's abdomen into the uterus and allows us to look up close at the blood vessels in the placenta. When we use this tiny camera, which is only 2 millimeters thick, we track all of the blood vessels throughout the placenta and find the vessels that are sharing blood between the two babies. And the vascular equator is probably going to be over here. So like, for example, there. Well, actually, no, it goes back. You see, look, it starts there and then it comes back in anastomosis to there. So that's probably okay. I think we'll just start where we can see. So laser on, please. And using laser surgery, we seal off those individual blood vessels. It's important, though, to only seal off the right blood vessels, because if you close blood vessels that are contributing to the baby's health and well-being, unfortunately, the baby will die.
I just don't think I could go through the pain of losing a child. You know, and then if one did survive, then what would they be going through? Because they say with identical twins, they'd feel that there's something missing with the other.
So I need to bring the plane along there to join there to there. Putting a camera through the uterus and the amniotic membranes might result in rupture of the membranes. And if this is going to happen, it typically happens within a couple of days of the procedure. So we need to monitor the mother very carefully in the days afterwards.
Hello, delivery. Samira, you know the lady that came up to the annex from Kaye the previous section?
Up and moving around the delivery suite, trying to help her labour progress, is Zosa, originally from Poland, and her Irish fiancé Dermot, who are expecting their first baby.
I wanted to go as natural as possible. Women have been given birth since, so it's natural for women, you know. They didn't have pain reliefs back then, or
I think for first-time mums, they have no idea what labour is going to be like, and I think for them, they probably think it might go one way. It's nice for them to have an idea, I think, and like a plan to follow. But
I
then
suppose it's not a plan.
Yeah.
You want to try sit on it?
It's cold. I want something on it first.
Yeah, I'll get
It's a sheet or something. Sit on that for a bit.
Quick, hot water bottle. Push on my back with your knee. Why are you pushing? I don't feel anything.
I'm pushing, don't worry. I was kind of watching and trying to help even. So.
Do you have strength today?
Yeah.
Yeah? Where is it?
It's going into your back.
I don't feel
He
it.
doesn't want to push you over. She was kind of vocal from the outset about what she wanted and what she didn't want. You can sit down if you want.
That might actually help you and me.
A little bossy, maybe.
Still need more pressure.
What way do you want to sit in the bed,
I'll be on my knees.
On your knees,
on your
no
knees.
problem. She wanted to change positions to help the labour move along, and it is shown to benefit that. So that's, you know, really, really good to do.
Oh, my back is really sore.
We'll get the hot water bottle back for you.
Oh.
Just lower down, was it? Here.
Nobody could apply enough pressure for me, like, even you, the midwives. I wasn't happy, like. I think I'm gonna sit back where I was the first time.
Background, like in the bed? Yeah, no problem.
Oh, it's just, you know, just like kind of cooling down, you know? This is annoying me because it's falling off.
I'm gonna have to put that behind your head there. Sorry. Now. Okay. Yeah. I mean, whatever goes, like.
Oh, it went.
It's not gonna stay.
Worth a try.
I think I was a bossy bitch. At some stage. Not all the time.
Kayla is checking how far Zosa is dilated since her last examination 2 hours ago.
Zosa, you're still 3.
Yeah.
Okay. So, because you're the same as you were last time, we just have to let the doctors know, all right?
Okay.
And because you're still 3, they normally like to start an oxytocin drip to give the contractions a bit more oomph behind them, all right, to get things going, okay? How do you feel about that?
I wasn't keen on the oxytocin because when you start having interventions, then in my mind it was like, okay, we'll do one, then the next one, then we'll end up with that. You know, I didn't want that. So I just wanted to go as natural as possible.
C2G is normal, it's lovely. Her obs are perfect. I've re-examined her and she is still 3 centimetres and she's not keen for oxytocin.
I'm not. I'm going to go. I've had my.
Sorry, Zosa. So I spoke to one of the doctors, all right? They're happy enough, I think, to give you 2 hours. We can reassess then. Now I'm going to relax the bed back, okay?
Then I need this out of my back because
There's a hot water.
In labour, it's hoped that mothers will dilate by about 1 centimetre per hour. 4 hours ago, Zosa had reached 3 centimetres.
Zosa, you're about 4. So, Zosa, since 10:15, that's 4 hours, you've made 1 centimetre. All right. How do you feel about the oxytocin drip now? To get things going.
I still don't want it.
You still don't want it? Okay. I do have to inform the doctors, all right?
Okay. I hate hospitals. Like, I don't like the beds, the machines, the lights, everything is like... So I think that's why I'm kind of slowed down with the contractions, because I wasn't at home.
She was the same last time. I rang Mohammed. He said give her another 2 hours because she didn't want oxytocin. She is now 4 and she still doesn't want oxytocin.
Zosa is sticking firmly to her birthing preference of having no medical intervention, including the hormone oxytocin, which stimulates labour. However, over the next 2 hours, very little progress is made.
So we're still 4, okay? How do you feel about the oxytocin now?
It's up to you. It's your choice.
I suppose, Zosa, like, ultimately, we want you to have a normal delivery. But if you're not getting closer to 10, the likelihood of that happening is not very high, okay?
It was kind of weighing up, you know, yeah, I know, Zosa, that you don't want oxytocin, but oxytocin might get you a normal delivery. Whereas, you know, no oxytocin might get you a cesarean section.
I don't know.
No.
I feel like I'm giving up.
Don't be giving up. You can't give up. You've no choice. You're in the middle of it.
Push my back.
I think you'll be good whatever decision you make. So I'm sure.
No, just push it, don't circle it, honey.
Oh, I still have tea bags in my pocket. Sniff. I can actually smell them from here. Like, they smell amazing. Pocket potpourri. Pocket potpourri.
It's the day after the twin-to-twin transfusion treatment, and Samantha is being scanned to see if her identical twins survive the night.
Sometimes when you seal off the blood vessels on the placenta, there's not enough blood supply in the placenta left for one baby. So it's possible that one baby's heartbeat may stop. That can be a particularly nerve-wracking time for the family to wait to see what are the heartbeats like. So that's the first baby. That's the baby who was getting too much fluid. He looks very strong, very good, strong heartbeat there. There's the second baby who was getting too little. Yeah, so it looks very good. Yeah, so certainly they both sound very, very good. When we looked on the ultrasound, you could see both babies moving around vigorously, both heartbeats very strong. So let's see what the fluid is like. So already you can tell that there's not nearly as much fluid around the larger baby, so that looks good. The placenta is much bigger, so there's less pressure on the placenta. So I think if we now just have a little bit of luck on our side and we run into no troubles in the next week or so, I would be very optimistic that things are going to go well for you. But obviously, we're still on early days. We'll see how things go. So, but it looks good, so we're very happy with it.
Thanks very much.
All right, okay. I'm delighted to be all right. All right, okay. Well done. Okay, Samantha. All right. Because a small percentage of patients who have twin-to-twin transfusion syndrome and have surgery for that condition will have a recurrence of the problem, they still need to be watched very carefully with scans every couple of weeks until the time of delivery. And hopefully over the coming months, Samantha will get up as far as potentially 34 weeks gestation before having a planned delivery.
Still a bit to go.
I'm 22 weeks pregnant now, and we still have that little bit of fear, but not as bad. And now we're just more excited now. Thanks very much. Thanks a lot.
I know you're wrecked, but you've done amazing work up to now. You have it in you. You've got to 4 on your own steam. And you might only need a small amount of oxytocin. You know, that's honestly, it's much better that you're in labour and getting a bit than us having to put you into labour with it. So you've done incredible work.
I was kind of thinking, like, we're here for hours, like, you're tired. If we keep going for hours longer and nothing's happening, then there's probably going to be more intervention needed later. So, and I knew they were worried about the baby's heart rate.
All right, and don't doubt
I'm
yourself.
Just stressed
I know.
that I won't be able to cope because.
After 8 grueling hours, Zosa has decided to go on the oxytocin drip to try to progress her labour.
I had the option. They didn't say, oh, you have to have it now, or, you know, yeah, like they offered it twice and we waited 2 hours, then another 2 hours. And
then I decided, okay, let's have it, you know, yeah. I just went with it.
Usually, like, women they don't like bright lights when they're labouring. So as kind of things moved along, the blinds came down, all the lights were turned off.
I don't think they're going to help, though.
The sunglasses was something I have heard of once before but never seen. Yeah.
It was very funny just watching you in the delivery room with the sunglasses
I
on,
didn't
your
care.
headphones on, and you were just in your own little world.
It's now just 2 hours since Zosa went on the drip to increase the intensity of her contractions.
You're 9.
Oh gosh.
Yeah, you're flying it. My manager, no. Where was you saying you weren't 10?
Yeah.
Yes.
Good woman. Oh, 9.
It really kicked in quickly, like, you know, and you could see your contractions were stronger, and they were very,
they were stronger.
Can I take this off?
Which?
Way
I think
too
I took
warm.
everything off.
Yeah.
I was just in my own world, really. I didn't even know what you were talking about. Were you talking about something? I don't know.
Very close.
Can I go?
Do you want to go out?
Up and down, eh? You felt like she was coming.
I
and you
just
really
wanted
weren't
to change position
Yeah.
because, you know, the movement will help, obviously, and gravity will help. So I wanted to get off the bed.
Oh, this could be...
She was kind of pushing on, squatting on all fours, and, you know, I had to get down to just see what was going on, just in case the baby made an appearance while she was near the floor.
While a squatting position can be great for bringing on delivery, the baby is showing signs of distress.
Zosa, that's her heartbeat, okay? So it's kind of doing the same thing it was earlier, okay? Can we get you into the bed?
The woman and her partner, they want to do the best for their baby and the best for themselves. And sometimes I hope that they won't feel disappointed if it doesn't just turn out according to the plan, because we don't really know what's going to happen, no matter how well prepared we can be, and the woman and her partner, still things may not go to plan.
She's not there, so every time you push, she comes forward, then she slides back.
And when she was nearly at the point of delivery, the heartbeat was obviously, it wasn't recovering as quickly as it had been.
Sophia, at this stage we need to think of giving you a hand with the delivery, okay?
Kayla has called on the help of Dr. Namreen for a second opinion on delivery.
Baby's heart is good, but it's dipping down in between, okay? What do you think if we need to give you a hand with the delivery? You'll be okay? Just putting a cup on baby's head?
Just to pull her out of it, yeah.
You're so close, all right? You're so close.
You can do it yourself. I can wait 10 more minutes.
Okay, but you have to
but you have to go hard.
almightily, okay? Yeah.
Come on.
Okay. Come on. Go for it. That's it. Come on. Come on. That's it. You're doing it.
She's on the way. She's on the way. Come on.
And another one. Come on.
Big one. Wow, she's on the way.
With pushing not going as well as hoped and signs of increasing baby distress, Zosa has opted for a small incision in the hope of avoiding an instrumental delivery.
Episiotomies are not nice. As a woman myself, the thought of one is just not nice.
Just some local anesthetic to numb the area, all right? You'll feel a sharp prick there.
Unfortunately, though, it can be the difference between a woman delivering a baby herself or needing an instrument to assist delivering the baby.
And again, right down
And
in
again,
the
a
bum.
small cut there now.
That's it. You can do it. You can do it. You can do it. Keep it going. Keep it going. Keep it going. Excellent.
I didn't want the instruments. I was like, I'm gonna do it myself. I can do it.
Come on.
All the way back and right down
Come on.
into your bum.
Right
Come
down,
on,
down,
that's it,
down,
really
down, down,
well.
down. Yeah, the baby's almost out. Come on. Keep it going.
Keep it
Come on,
going.
big push.
Okay, big deep breath in.
Blow,
That's it.
blow,
Blow,
blow, blow.
blow,
Good.
blow. That's it. And have a look.
Oh
my God.
Oh my God, it's just the best feeling in the world. Like, it's beyond words. You can't describe it. It's like she's in your tummy and then she's on your chest and you have her. It's like, it's amazing.
Yeah, it was wonderful. Yeah, there's a nappy there. Now we have a baby to look after, and
Yeah, meeting her for the first time.
yeah, it's amazing. It's that long wait, I think, you know, like you're waiting 9 months and then she's suddenly with you.
Yeah, just meeting her for the first time and having her on my chest. It's amazing. I'm like, we actually have a daughter. She's ours. A little human.